Hi guys, today we're doing a cheek case in the AAFE training center. You can see here that I am drawing on my treatment markings on this patient's face. I drew a triangle from one line lateral canthus to the oral commissure to the tragus, and then another line from the tragus to the lateral canthus of the eye, a circle that touches all the sides of the triangle. And that's gonna kind of keep me in my safe zone or my safer zone than elsewhere. I marked the infraorbital foramen. That is where, of course, very important structures come out of, and we want to stay far away from there. We will not be going any more medial than this line that we've marked from the lateral canthus to the oral commissure. And if we do, I'll just, stay near it. You can see here that I've started to inject, and I am using a heavy filler. This filler that I am using today is a Juvederm Voluma, and that has a really high G prime, so it helps kind of mimic bone. I'm placing that product deep down on the patient's zygoma. You can see here that I'm using my left hand with a piece of gauze to really support that tissue, and then I'm using my right hand to push the product, of course with proper aspiration prior to each injection. I'm laying no more than 0.1 cc's of product with each injection. We don't want to put more because then we run the risk, or our risk for occlusion is higher, or compression with that heavy filler on top of a vessel. I'm always evaluating what this cheek is looking like, and you can see this patient is starting to swell a little bit. That's okay, that's expected, and the patient has been educated about that. I continue on. I kind of started near the apex of the cheek, or where that apex should be, and I determined that, one, by assessing the patient's face as a whole and looking from all different angles, and two, from drawing those lines. That kind of helped me draw my eye to that point where I think the apex should be. I work my way back from that apex along the zygoma and then forward. You can see I am outside of that line I marked, but I'm not far from it. I don't like to stray too far because we do want to stay as safe as possible. And here you can see I'm kind of moving back, so I walked around the patient, I evaluated a little bit, and you can see here that I am kind of manipulating my needle so that I am on bone. If you're not on bone, you do not want to inject. So sometimes you do have to come out and kind of reset. Back here, that far posterior, that zygoma does get very, very narrow. So that's why it's sometimes a little bit difficult to find it. No big deal. You don't want to fish around too much. So I kind of reset, and then I go back in and add wherever I see that deficiency still is. You can see here that I decided I needed a little bit more in the kind of right in the apple of that cheek. As we age, we definitely lose midface volume. In this patient, it's apparent in kind of where that apex should be. I want to build that lateral support, of course, but we also need to focus on building that, that apex and the apple of that cheek so that the eye is kind of drawn there rather than that lower face or, more laterally. You can see here I'm adding a little bit more posteriorly, and I'm really wrapping up the rest of this syringe. I've used a total of 1 cc on each side for this patient, and you'll see at the end we ended up with a really nice result. I'm just doing one more injection, and then I'm finishing up that syringe. You'll see that I start to really smooth this product out. Of course, prior to each injection, I'm doing a proper aspiration and using that gauze. I'm cleaning off my marks now, and I clean those off anytime they become kind of more distracting than helpful. Of course, I always want to maintain safety. That is my number one priority. Wiping all of that off. She's not bruised too badly. She does have a little hematoma posteriorly, and I'm kind of just massaging it slightly, not too much pressure because it will be painful for the patient. I have some arnica gel back there on the cheek, and I'm going to use that with some gauze to really kind of manipulate that product. I'm using gentle pressure to just make sure that all of that product is kind of integrated into the tissue, no major lumps or bumps, and I'm evaluating from behind the patient so I can see really how that cheek is looking. Stay tuned to see this after. Here you can see that I am checking cap refill around that bruise just to be sure that her cap refill is within normal limits, and it is. So after all, it is just a small little bruise and we're not too concerned. Check out this final product.